Picture this. An otherwise healthy 62-year-old walks into urgent care with a bad cough and fever. They leave a week later with a hospital discharge summary and a diagnosis that could have been far less severe if a pneumococcal vaccine had been given years earlier. That avoidable week in the hospital is exactly why adult vaccines matter. I'm Jess, a family nurse practitioner and legal nurse consultant. Welcome to FAQ by Nurse Jessi, where healthcare facts beat internet myths. Today, I'll give you a simple roadmap: what adults commonly need, why, and exactly how to get caught up without the confusion.
First, the core idea. Immunity changes. Some vaccine protection weakens over time. New strains can appear. So being up to date is about practical protection for your age, health, and life circumstances. Not perfection, but prevention that matters. Quick basics you can keep in your head. Live vaccines use a weakened germ. Inactivated or recombinant ones use parts or proteins. And newer platforms like mRNA teach the immune system using genetic instructions. Boosters are refresher doses. They sharpen the immune response. They don't overload it. Side effects are usually short-lived. Sore arm, tiredness, maybe a low-grade fever. Severe reactions are rare.
Let's walk through the core adult vaccines and the typical reasons people need them. Start with influenza, an annual shot for everyone 6 months and up. Think of it as a yearly tune-up because the virus changes every season. Shingles vaccine, the recombinant zoster vaccine, commonly called Shingrix, is recommended for most adults 50 and older as a 2-dose series. It cuts the chance of shingles and the painful post-herpetic neuralgia that follows for some people.
So, if I'm 52, should I get Shingrix, Yao?
Yes, for most 52-year-olds, the recommendation is to get Shingrix unless there's a specific reason you can't. It's 2 doses separated by 2 to 6 months and offers strong protection. If you have a complex immune issue, check with your clinician. Timing and options can change.
HPV vaccine usually happens in adolescence, but adults through age 26 should be vaccinated if they haven't been. For adults 27 to 45, the decision is individualized. Talk to your provider about your sexual history and risk factors before deciding.
Pneumococcal vaccines protect against dangerous bacterial pneumonia. Recommendations depend on your age and medical conditions. Many adults 65 and older should receive pneumococcal protection, and younger adults with chronic illnesses may also need it. The exact product and timing vary, which is one reason a quick check with your clinician matters. COVID boosters follow the same logic as flu: variants and waning immunity. Current boosters aim at circulating strains. If you're older or have chronic conditions, prioritize staying current. Check CDC guidance or your clinic for the latest timing.
Okay, 2 minutes to make this actionable. First, find your records: MyChart, your clinic portal, or the state immunization registry. Second, look for gaps, missing dates, or very old entries. Third, note special situations: pregnancy, immunosuppression, or upcoming travel. Those change recommendations. What if my clinic doesn't have a vaccine I need?
Good question. Pharmacies, public health clinics, and local health departments often provide vaccines. Call ahead to check availability and coverage, and always ask for documentation: lot number, manufacturer, and date, so your record stays complete. Here are exact scripts you can use. Try, "Hi, I want to make sure I'm up to date on adult vaccines. Could you check my immunization record and recommend what I need today?" If you've identified gaps, say, "I don't see a record for Shingrix or my pneumococcal vaccine. Can we review if I'm due?" For pregnancy, "I'm pregnant. I'd like to get Tdap and the flu vaccine at the recommended times. Can we plan those today?" Special situations in one breath. Pregnancy. Get flu and Tdap at the recommended times and avoid live vaccines like MMR during pregnancy. Immunocompromised patients need individualized plans and often avoid live vaccines. Travel may require vaccines like typhoid or yellow fever. See a travel clinic well before your trip. Safety notes to keep in mind. If you have a known severe allergy to a vaccine component, that specific vaccine is usually avoided or given under specialist supervision. For most people, local soreness or short-lived flu-like symptoms are normal. Serious events like anaphylaxis are rare, and clinics are prepared to manage them.
Before we wrap up, 3 takeaways you can act on this week. 1. Find your vaccine record, patient portal, clinic, or state registry. 2. Bring a short script I gave you and ask for a catch-up plan. Can you review my record and tell me what I need today? 3. Prioritize annual flu, Tdap once in adulthood and during each pregnancy, and talk with your provider about shingles at 50 and pneumococcal vaccines if you're 65 or have certain risk factors.
If you'd like a printable one-page roadmap, check the show notes. There's a checklist you can bring to appointments. A quick reminder, this episode is general information and not a substitute for personalized medical advice. If you have complex conditions, are immunocompromised, or are pregnant, please consult your primary care clinician or a specialist.
Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how preventive care and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant. You can learn more or schedule a consultation at faqbynurseJessconsulting.com.
If this episode helped you, please subscribe to FAQ by Nurse Jessi for more practical, evidence-based health guidance. Share it with someone who makes healthcare decisions for themselves or a family member. It makes a difference. Until next time, stay informed, stay compassionate, and always put safety first.